taking a skeletal muscle relaxant. My name is Dantrolin, and that is my generic name. The names of some of my friends are incubotulinum toxin A, onabotulinum toxin A, and then ribabotulinum toxin B. My brand names include Dantrium, Xeomin, Botox, Botox Cosmetics, and Myoblock. My chemical name is flash on the screen. Now for my drug classification. Therapeutic. That I acts within the skeletal muscle fibers and interfere with calcium ion release from the muscle tubules. Therefore, the fibers are prevented from contracting. It does not interfere with neuromuscular transmission and does not affect skeletal muscle surface membrane. Botulinum toxin A and B bind directly to the receptor sites of motor nerve terminals and inhibit the release of acetylcholine, leading to local muscle paralysis. For my pharmacologic effect, I enter the muscle to prevent muscle contraction directly. My pregnancy category is category C. For my mechanism of action, I am a direct-acting skeletal muscle relaxant which inhibit muscle contraction by decreasing calcium release from sarcoplasmic reticulum in muscle cells. My pharmacokinetics are absorption is in the gastrointestinal. My distribution is unknown, my metabolism is unknown, and my excretion is in the kidney or through the urine. For my indication, I have different categories of indication. This is to prevent muscle contraction directly. In children, I am safety and effectiveness is not established in children. Dantrolene is used to treat upper motor neuron spasticity in children. Dose should be accurately calculated based on body weight and it increases over time. Children are at increased risk of CNS and GI toxicity. Now for adults. They should be cautioned to avoid activities that require alertness, e.g. driving, because drugs can cause confusion and drowsiness. For pregnant and lactating women, should be advised to use contraception and alternative method of feeding respectively. Premenopausal women are at increased risk of hepatotoxicity in association with the use of me. Now for older adults, they are more likely to experience adverse effects associated with these drugs. Older women who are receiving hormone replacement therapy may have the same risk for hepatotoxicity with premenopausal women in association with the use of dantrolene. For my contraindications, allergy to any component of the drug to prevent hypersensitivity reaction, spasticity that contributes to locomotion, upright position, and increased function. This function will be lost if spasticity were blocked. For example, like active hepatic disease, interfere with the metabolism of the drug. For the pregnancy, potential adverse effects to the fetus. For lactation, may cross breast milk and may cause adverse effects in the infant. Now, women and patients older than age 35, caution is applied because of increased risk of potential fatal hepatocellular disease. So for history of liver disease or previous dysfunction, increase in liver susceptibility to cellular toxicity. For the respiratory depression exacerbated by muscle weakness, cardiac disease, cardiac muscle depression may be at risk. Now let's proceed to the side and adverse effects.
Now we will tackle my side and adverse effects. But before that, since I have a classifications of drugs. Later, we will discuss each side and adverse effects one by one. But first, we will discuss its general adverse and side effects, wherein I can cause a CNS problem, which are drowsiness, fatigue, weakness, confusion, headache, insomnia, visual disturbances, and for your GI tract, which is I can cause GI irritation, diarrhea, constipation, abdominal cramps, and for your genitourinary, I can cause urinary frequency, um, enuresis, urinary urgency, crystalline urine with pain or burning in urination, and other side and adverse effects are acne, abnormal hair growth, rashes, photosensitivity, abnormal sweating, chills, and myalgia. And for the classification, dantrolene is one of my classification. And dantrolene can cause a direct hepatocellular damage and potentially fatal hepatitis. And second is the botulinum. Botulinum toxins are associated with anaphylactic reaction. So let's go for the nursing responsibilities. Um, First is the assessment, wherein for the assessment, you have to assess for the mentioned contraindications and cautions on me. Like for example, the drug allergy, the cardiac depression, rheumatic disorder, pregnancy and lactation, and etc. And to prevent untoward complications. And also, as a nurse, you have to conduct a thorough physical assessment, like getting the temperature, observing the skin color and lesions, the CNS orientation, effect, the reflexes, the bilateral grip strength, the spasticity, and the vowel sounds and urine output to obtain a baseline data. And of course, you have to monitor the liver and the renal function test. And for the nursing consideration in administering my classifications, first is we will discuss the administering in dantrolene, which is one of my classification. Uh, Monitor intravenous site of dantrolene for potential extravasation because the drug is alkaline and very irritating to the tissues. And periodically continue for 2 to 4 days. 2 to 4 days to monitor the therapeutic effectiveness. And discontinue using if diarrhea is severe to prevent dehydration and electrolyte imbalances. And also, we will proceed to the other component, which is the onabotulinum toxin A. The nursing consideration for this drug is first you have to monitor the patient for swallowing and breathing difficulties, which can lead to death, and start treatment at lowest recommended dosage. Watch for bronchitis and URI in patients being treated for upper limb spasticity, and discontinue a antiplatelet drug therapy at least 3 days before the injection procedure. Um, patients Patients on anticoagulant therapy need to be managed appropriately to decrease the bleeding risk. And lastly, repeat treatment when effect of previous injection has diminished.
the end of my blog. I hope that you had enjoyed and learned something.